Hi, my name is CVellekoop and I'm applying for the Advanced Level Facilitator training for RAP. So today I'm going to be talking about the 5 key recovery concepts, as well as Wellness Recovery Action Planning, also known as RAP. So I'll start by saying that RAP, or Wellness Recovery Action Planning, was developed by Mary Ellen Copeland and a group of people who wanted a tool to assist them in their own mental health recovery and something to help other people as well. So I'm going to start with the 5 key recovery concepts, which are hope, personal responsibility, education, self-advocacy, and support. Hope. There is much to hope for. It's really important to remember this because you have to believe that there is hope, that you can get well and stay well. Finding things that gave me hope was really helpful for me. For example, seeing people who have struggles that I felt were more significant than mine, and overcoming their struggles and meeting their goals really reminds me that I can do it too, as well as others. Personal responsibility. So it's important to remember that you are the expert on yourself. It's up to you to decide what you want to do in your life and the choices that you make. It's pretty easy to blame other people or circumstances for situations that arise, but at the end of the day, it's you who's making the decisions that are either going to help or hinder yourself. Next, we're going to talk about education. So one way you can really take personal responsibility is to educate yourself. You want to make sure that you educate yourself on things like things that can help you achieve wellness. So whether that's learning about different resources or learning about different groups that you can attend in your area, or other things that may assist you, education really is key. Next, we talk about self-advocacy. So you really need to be a strong advocate for yourself. This means knowing your rights and standing up for what you believe is best for you. One thing that always really stood out to me is the right to make mistakes. I am constantly reminding myself that it's okay to make mistakes, and I also let other people know that as well. So lastly, we're going to talk about support. It's really important to have supportive relationships with people who want to help you or see you achieve wellness. And RAP talks a lot about support and the importance of having support from others, which is great. Okay, so now that we've reviewed those 5 key recovery concepts, which again were hope, personal responsibility, education, self-advocacy, and support, we're now going to talk about Wellness Recovery Action Planning, or RAP. So RAP is really a voluntary tool, and it can only be completed by you. Help from others in writing or developing your RAP is great, but at the end of the day, your RAP is developed by you, and if it's not, then it's not truly RAP. And everything in your RAP is geared towards you personally. So we're going to talk about wellness tools. And wellness tools in RAP are really just simple, safe things that help you stay well, or things that may make you feel better when you're not feeling so great. And like I said, they are really safe and simple things that you can do and you enjoy doing. Some wellness common tools might be things like journaling or going out with friends, swimming, really anything that you enjoy doing. For me, I have many things on my list of wellness tools. Some of my tools include things like gardening, visiting friends, listening to music, going for drives. Just being outdoors is a big thing for me. And it's really important to remember to take that personal responsibility, even in your wellness tools, and kind of knowing when you need to use them. That's pretty great. Next, we talk about what I'm like when I'm well. And it's really important to have kind of a reference point to determine what you are like when you're well. And so then you can also kind of determine if you might be struggling. And like I said, it's really important, and it's really just a simple list of character traits that describe you when you're well. My list of what I'm like when I'm well includes things like I'm humorous, I'm pretty charismatic, I enjoy being around other people, people say that I'm pretty easy to get along with, I'm responsible, and I'm pretty cheerful. Um, it's also a good reference point for your supporters to identify when you're well and, like I said, when you're not well. So next we're going to talk about the daily maintenance list, which is really a list of things that you need to do every day to stay well, or things that you feel you need to do every day to stay well. It's really easiest if this list is kind of short and sweet and simple, and it can include things as simple as making your bed or having a shower every day, to making sure that you exercise every day, have 3 balanced meals, remembering to take your medication, just things like that. Very simple, easy, mindful things to do. It's another reminder of kind of that self-advocacy piece and knowing what's best for you and what you need to do to stay well every day. Some of the things on my daily maintenance list include brushing my teeth every morning, taking my medication, and checking in with friends and sometimes family on a daily basis. You may also want to include a list of things that you might do on any given day to stay well. So maybe you don't go to the theater every day to catch a movie, but you might go, on any given day to catch a movie. That might help you stay well. For me, I know that I might go visit my friend who has some young kids and just hang out with them because I really enjoy that, and I find that that does help me stay well. I may also do some scrapbooking or head out and do some photography, things like that. Take some pictures, do whatever. Those things kind of help me stay well, but I may not do them every single day. Next, we're going to talk about triggers. So triggers are really those external events which may cause a somewhat negative reaction from you, sometimes positive. And it might be a specific event or circumstance. For some people, it's a particular scent that may be a trigger for them. Triggers are kind of those things that set you off, so to speak. So in facilitating RAP groups, I have spoken with a lot of people about their triggers. One woman actually said that the smell of rum was a trigger for her. Other people that I've talked to have said violent scenes in movies, people yelling, things like that are kind of triggers for them. Some of my triggers kind of include feeling left out or unappreciated, feeling pressured into doing things, and financial stress is also a trigger for me. So to deal with those triggers, we're going to come up with a triggers action plan. So triggers action plan is a plan for how you will deal with your triggers before they occur, or while they occur if they can't be avoided. You might have a specific plan for a specific trigger. For example, if it's something work related, you may have a plan to talk to your boss about it or a coworker, or maybe take some time off work. When my triggers come up, or I anticipate kind of a stressful situation coming up, I always call a friend who's one of my supporters. And again, support is really important in RAP, and it's really important for me to have those support people in my life. And just kind of that having someone to talk to and listen is often a really big relief for me. If I'm triggered by something minor and I can't get in touch with a friend, I can usually just head out for a drive, go for a walk with my dog, or listen to music, and that's often very helpful as well. So that is a part of my action plan. Now we're going to talk about early warning signs. So these are just really subtle signs that things may be starting to unravel a bit. You may not even notice these signs, but others in your life might be able to help you identify them. So if you can catch these signs, you may be able to stop yourself from heading into a crisis. Some of my early warning signs include sort of starting to isolate myself a little bit, not keeping on top of household chores, and kind of a heightened sense of anxiety, but not overwhelming. So after you've identified your early warning signs, we want to come up with an action plan, much like the triggers action plan, to deal with those early warning signs. So it again just provides you with a list of things that you can do to help you get back to feeling as well as possible, or reduce those feelings that are produced by your early warning signs. And again, supports are a really big part of my RAP. So again, for me, talking to a friend as part of my early warning signs action plan, and ensuring that I'm not isolating myself. Next, we're going to talk about when things are breaking down. And these are really those signs that things have taken a turn for the worse. And you may need to make a critical decision to deal with the issues at hand or allow them to take over. And this often does signal a crisis. So some of my signs that things are breaking down include a really overwhelming sense of anxiety, which often results in panic attacks and crying, feeling depressed at times, and just kind of not feeling like myself at all, not being cheerful, not being happy, things like that. So again, like the early warning signs and like the triggers, we're going to come up with an action plan to deal with those when things are breaking down signs. So with the action plan, you want to have really specific steps that you have to take to avoid slipping into a crisis. The list should be short and direct, with fewer choices and more directives of what you need to do. If you have a strong action plan, you can take back control and really avoid a crisis situation. My action plan, again, includes calling or visiting one of my supporters, and making sure that I do get out of the house so that I'm not isolating myself. And again, that could be something as simple as going to the grocery store, just making sure that I leave my front door. So now we're going to talk about crisis planning or advanced directives. So this really explains exactly how you want to be helped when you can't take care of yourself when you're in a crisis. So this consists of 9 parts, which I'll review independently. And it's really important that your crisis plan is clear, so that when others do need to take over, they know exactly what is expected of them and what you expect them to do for you. And although you might not feel it, crisis plans really do keep you in control by telling others exactly what's best for you during a crisis. I find too that after working through the action plans, the early warning signs, when things are breaking down, triggers, those action plans, and the other aspects of RAP as well that we've discussed, it may make you kind of want to redefine what a crisis is for you. Alright, so the first part of the crisis plan is what I'm like when I'm well. So in the crisis plan, we revisit the list of what I'm like when I'm well, which again is those character traits that kind of describe you when you're well. And it's just so that people don't make assumptions based on how you're acting. So for example, some people may be really withdrawn when they're well, and you might see that as a sign that they're not well, but in fact, for them, that means that they are well. The second part is symptoms. So you really want to identify the signs that the crisis plan needs to be implemented. These signs might include, for some folks, things like thoughts of self-harm, just being forgetful, avoiding responsibilities, things like that. Some of my symptoms include not caring about things, kind of have that who cares sort of attitude, excessive crying, and not taking my medication daily. The third part of the crisis plan is the list of supporters. So it's really, really, really important that you do have 5 supporters, just in case some of them aren't available when you're in a crisis, or maybe they're unable to support you at that time. And you can have specific tasks or roles for each of your supporters to play, or things that you don't want them to do. That's totally fine too. And you can also include a specific list of people you do not want involved in your crisis plan, or people you don't want to support you. The next part is about medications. So this part really simply just lists the medications and supplements you're currently taking. It also includes any allergies, your pharmacist's name and information, your doctor's name and information, pretty much anything kind of health related. And it's really, really important to keep this up to date to ensure accuracy in any treatments or anything that you might need to do. Next, we're going to talk about treatments. So some people may have some alternate treatments as opposed to the regular kind of medicinal treatments. And they may prefer that or complement that with their medicinal treatments. So it might include something like massage therapy, reflexology, even something like art therapy could be a complementary treatment for some folks. Now we're going to talk about home care or respite plan. You may find that it is beneficial to have a plan to avoid hospitalization, whether that means going to a respite center, a mental health center, staying at a relative's house, or having somebody come stay with you. With the strong support network, this can be really, really beneficial to kind of avoiding that hospitalization. We're going to talk about help from others. So this section really outlines what you find to be helpful in a crisis situation. So this area is really important, and it does deserve special attention because it's what you need from others. So it also includes what is not helpful for you in times of crisis and could actually make things worse. Things for me that might not be helpful include things like people talking down to me, or people trying to sort of one up my situation. Sort of that whole, you did this, well, I've done this sort of thing. It's not very helpful for me. Now we're going to talk about inactivating the plan. So these are those specific indicators that the plan is no longer needed, doesn't need to be followed. And this does need to be very, very specific so that people know exactly when you can move from the crisis plan to the post-crisis plan, which we'll get into in a sec. And this might be something as little as being able to laugh at a joke for some folks, or more substantial, such as being able to sleep through the night for 3 consecutive nights, let's say. It's really about you and what you feel is kind of that sign that the plan is no longer needed. It's really important to remember, that your supporters all need to have an up-to-date, clear crisis plan or advance directive. So they're clear on what's expected of them, what you expect, and kind of how you expect to be dealt with during a crisis situation. If anything changes, it is important to update your crisis plan, keeping it really current and relevant. Your crisis plan can become a legal binding document if signed off by an attorney, but that doesn't always mean that it's going to be followed. Next, we're going to talk about the post-crisis plan, which I mentioned. So once you are starting to feel better, that's awesome. And once you've sort of felt as though you've worked through that crisis, you can start using your crisis plan. So this just kind of identifies how you're going to move from that crisis mode back into everyday life and feeling well again. So the post-crisis plan really identifies how you will make that transition back to everyday life. And it also really outlines if there are any amends you need to make, things you need to take back responsibility or control over, things you may need to take care of. So for example, maybe you haven't paid your bills because you've been preoccupied with other things. So maybe taking care of that, or resuming care of your pets or kids or something like that. It also outlines the benefit of using a timetable to resume your responsibilities. So this might mean having somebody assist you with daily chores, or maybe going back to work part-time rather than full-time, and gradually getting up to that full-time employment again. And yeah, it's just kind of that means of getting you back into your regular routine. So with that concludes my summary of the 5 key concepts of mental health and wellness recovery action planning. Thank you.